Hi guys, Dr. Pelto here. Today I'm going to go over 4 different foot care tips for you if you're at home. My tip number 1 is that if you're at home, you should be wearing some type of shoe on your foot. This is specifically important for people that have foot pain. Many of my patients that have plantar fasciitis, that have Achilles tendonitis, they have hardwood floors at home or they have carpet and they're walking barefoot much of the time. And when you're barefoot, it makes your foot have to work so much harder. So I recommend it when you're at home, you could wear some type of a shoe. For those patients that don't like to wear shoes at home, I recommend getting a second pair of home shoes. Now, home shoes are different than a slipper because a slipper doesn't offer any support on your foot. They might be used to keep your foot warm, but we don't realize how much time we spend standing or moving around at home. Get another pair of athletic shoes such as Hoka, Asics, New Balance, something else like that. Another option, which many of my patients like to do, is they like a sandal or a flip-flop type of a device. My favorite is called an OOFOS, OOFOS. It has a very high arch. You can put it by your bedside and you can walk around your house with those because they give you added support. So that's what I recommend. If you have foot pain, you should be wearing something on your foot all the time, even when you're at home. My tip number 2, if you're at home, to protect your feet, I don't recommend walking with the lights off. I know this sounds obvious, but multiple times a year, I have patients that might be walking in their living room with the lights off, or they might be walking to the bathroom with their lights off, and they end up hitting their foot. Usually they hit their foot on either a door jamb, they'll hit it on a door, or they'll hit it on their bedpost. And what happens, it usually hits on the toes on the outside, and then the toes get pushed over, and they tend to break some of their toes. So a word to the wise, if you are walking around, first of all, put on the shoes like I talked about before, or some type of a flip-flop to protect your foot. And then second, I would recommend don't walk around in the dark. And sometimes it can be the dark. The other reason is if people are in a rush. If they're rushing from one place to another, they can cause this. If you do injure it and your toe gets kind of bent back, I would recommend coming to see someone, because if you have a toe break, usually it's not a problem, but occasionally it is. Tip number 3 is to avoid foot problems at home is something that's very common in the winter time. And not just the winter, but this is when I see it most of the time. There is a condition that can happen if your feet get cold. And for some reason, I specifically see this in people that are very, very slender. I typically see it in females. And there's a condition, there's a couple of different names. You could call it Raynaud's, you could call it chilblains, or I just simply call it for patients, they have some cold injury to the toes. And this is very common. It's common for a couple of reasons. Many people today are sitting at their desks with their feet down, and their desks tend to be near the wall, and the wall gets cold. And so they may be in barefoot, they may have socks on, but they're sitting for extended periods of time without walking around, which moves the blood, and then their feet get cold. And this coldness can happen from being in your house. And what happens is it develops little red dots at the tips of your toes, and your toes can become itchy. I had a patient recently that came in. They thought they had athlete's foot, and it wasn't athlete's foot. It was because of a cold injury that they had to their toes. So what can you do? Well, you can get up every 15, 20 minutes to get the blood moving. You can wear socks to keep your feet warm. And then you could also wear shoes at home to prevent this. The telltale sign I find with patients is that when they heat up their toes, like when they're taking a shower and they heat them up, they start to itch. And they may even slough off some of the skin on the tips because the skin has to turn over after they have that cold injury. And lastly, when they are outside, their feet get cold quite quick. So you have to be careful when you're at home and when you're out to avoid prolonged exposure. And then even something to be aware of, some patients, they try to put a lot of socks on and their feet sweat, and then their feet get cold, especially outside. They're outside, their feet sweat, they get cold, and then it freezes the toes, and this can become problematic. So this is tip number 3, especially for the winter time here, if you're in an area that has colder temperatures in the winter. My tip number 4 for you to stay safe with your feet at home is to avoid bathroom surgery. Frequently, I have patients that come in and their toes are all bloody, and they try to get out their own ingrown toenail. They may have their own special nipper. They may try to use little scissors. They may try to do like a tweezers to pull it out. I don't recommend pulling out your own toenail unless you know how to do it. Usually you should trim your toenails straight across. You shouldn't dig into the edges. If you're having to dig into the edge, it most likely means that you're having a problem. So I would see someone for that. But don't do your own home surgery. Don't use your own nipper to get out the edge. Don't cut your own calluses. At most, you should maybe buff them down with a pumice stone. but be very careful, especially if you are diabetic, because many times diabetics, they don't have the best feeling. You should really see someone to help you with that. So those are the 4 tips to help your feet stay healthier at home. So stay home, don't have foot problems. If you want to learn more, I have a couple of booklets that I put together about keeping your feet safe from any types of foot problems. I'll put a link underneath this video that you can learn more.